A study by independent news website, The Conversation, that's what it's called, it's found that around 1/3 of Western Cape adolescents are struggling with depression. Alcohol consumption, drug use and violence at home are some of the factors affecting these teenagers. Let's bring into the conversation now the UCT mental health researcher, Mariam Mkhize. We also have in this conversation the Social Development Department's Cynthia Nyoni, and joining us is Dr. Eve, a very well-known therapist. To all of you, thank you very much for your time. I want to start with you, Dr. Eve. When you hear of these worrying stats, the understanding is that a large number of children, and they are between the ages 10 and 14, a study was conducted on them, and it is found that a large portion of them, the numbers aren't quite clear, but a large portion of them are struggling with depression and anxiety. How do you think children at such a young age can be helped to overcome this?
Take away the social media. That's what is indicating to us is one of the prime, if not the prime reason for this epidemic of youth mental health issues, concerns, illnesses that we've seen in our country and across the entire Western world. There is superb research that has come out most recently from Jonathan Haidt, who is a social psychologist at NYU. He's written a book called The Anxious Generation. And he talks about the incredible change that has happened in the youth from the time that social media has been in their hands. And if I may, I want to quote some of those statistics which may underlie the shocking facts that we're faced with in our country. So he looked at what the change was from 2008, which is when Gen Zs really came into the world, to his research goes up to 2018. And just to quote you some of it, that from 2008 to 2018, anxiety increased 134% in 2010. Depression increased by 105%. ADHD increased by 72%. Bipolar disease, or the diagnosis thereof, increased by 57%. Anorexia, eating disorder, increased by 100%. Substance abuse and use increased by 73%, and schizophrenia, psychosis also increased. This means self-harm, disordered eating, anorexia, depression, anxiety, suicidality has had an enormous increase. And when he looked at the origin of what was different, what happened in those years between 2008 and 2018, he noticed that the biggest change was exposure to social media in that age group. And what happened there was there has been what we call the rewiring of the brain. And I'll go into more detail around the neuroscience around it, Zoli, if you want me to, but maybe you want the other guests to weigh in before we go into the neuroscience.
Indeed. Let's give the opportunity to Mariam Mkhize, a researcher, a mental health researcher attached to the University of Cape Town. Mariam, good evening to you. Let's talk about these young people. These are people whose brains are still developing. In fact, Dr. Eve was about to go into that. But when you factor in alcohol consumption, drug use, and violence at the home front, does that become even more difficult to deal with? Because in all probability, there is an unstable home environment as well.
Thank you, Cody, for that question. And most definitely, I think just to provide more insight into the research that we conducted, just so that the viewers at home can have a better understanding. Myself, Professor Catherine Soestel, and Professor Claire van der Westhuizen conducted this research, which is funded by the Sue Strungman Initiative, which forms part of a larger research project that seeks to address the mental health needs of young adolescents. And as you said correctly, we went to 10 schools in the Western Cape province in collaboration with 3 community organizations. And these are schools that are in under-resourced areas in the Western Cape province. And this is also particularly important. And we found that of the 621 adolescents, 33% of these 10 to 14-year-olds reported to experience symptoms of depression, and 21% of these adolescents reported to experience symptoms of anxiety. And with regards to the factors that you are relating to, for us, it was very important to have a comprehensive understanding of not only, the prevalence of anxiety and depression, but what are the specific risk factors within our South African context that make these young adolescents more susceptible to develop anxiety and depression. And in our research, we found that for depression specifically, being in a higher grade in school, the use of alcohol, the use of other drugs, and witnessing violence at home among adults was a risk factor for these adolescents. And while for anxiety, we found that poor emotional regulation skills, being in a higher grade in school, and the use of cannabis were risk factors that were associated with these young adolescents developing anxiety symptoms. So as you say clearly, there definitely needs to be more action that's taken to address the context that our adolescents are living in. And as our research has shown, that there's an interplay between individual, environmental, and social factors, which make the 10 to 14-year-old very young adolescents more susceptible to developing depression and anxiety. And for us, it was very important to conduct this research because this is the first research in South Africa that has looked at anxiety and depression among these young adolescents.
Yeah.
And also just underscores the importance that we need to have more comprehensive mental health support for adolescents in school settings.
Yeah. Let's bring into the conversation Cynthia Nyoni. She is with the Social Development Department. Ms. Nyoni, good evening to you. When you hear the kind of deep research that's been done here by Ms. Mkhize and her colleagues at the University of Cape Town, how does the Social Development Department help in such situations? Because these are children that come from underprivileged areas.
Yes, good evening, Polly, and thank you for inviting the department to this conversation. I think this is a very critical conversation that really, requires us to work, collaboratively with research, with, experiences in terms of the caseloads and the reports that we get where children are affected. There are a myriad of challenges that children are faced with, be it at home, at school, the communities, and the environment where they interact with each other as children. So as the Department of Social Development, we are not really the experts in terms of dealing with issues of mental health. But where we come in is where we also, provide support in terms of interventions that we have in the different programs that we have as a department. Maybe if I can mention that to say our stronghold as the department is where we seek to work collaboratively, to raise these issues with communities where children have been found either being, abused, neglected, or abandoned, and also, issues that are affecting them that also impact on their emotional well-being.
Yeah.
And also where we come in with interventions where we can say, let's work with those who are experts to collaboratively come up with programs that will be sustainable, where children will go for help as and when they need such services. Because children that we have consulted in different provinces, because as the department, as I said, we are, very big on advocacy, working with other stakeholders. Here we're trying to raise, awareness in the different communities to say children have raised issues as we consult with on, platforms, different platforms that we have, be it the Children's Parliament, be it, the 365 days child protection programs where we say no violence against children is acceptable, and also our legislations make provisions for us to be able to can protect children. I mean, the Children's Act is very key in this instance where we say that children have the right to participate in matters that are affecting them, especially this age that we're talking about, the 10 to 13. Working with the Department of Health, we've also received statistics together with the Department of Education, where we have identified high-risk schools in the different districts within the different provinces that we have embarked on in implementing this 365 days, where children were given platforms to also, come on board for us to collaboratively working with children to come up with interventions that would best suit the children, because we've realized that as professionals or different stakeholders, we tend to just design or come up with programs that might not necessarily suit the children, especially in the days that we live in, where technology is also, what children use more than us as adults.
All right.
So we've children are raising issues to say, at home we are being, abused. At home we are being, our parents are using corporal punishment, and parents in general don't know how to communicate with us as children. And these factors are affecting us mentally and emotionally as well.
Yeah. All right. Dr. Eve, I know that you wanted to bring up the question around the developing brain of these children. I'd like to pick up on that point when we return. We're going to take a short break and continue the conversation shortly thereafter. If you're just joining us, we are wrapping up a conversation around anxiety and depression among adolescents. And still with us for this conversation is Cynthia Nyoni. She is with the Social Development Department. We also have Mariam Mkhize, a mental health researcher at the University of Cape Town, and they are the people that conducted this study. We also have Dr. Eve, a family therapist. Let me pick up with you, Dr. Eve. Earlier, you made reference to these are young minds whose brains are still developing. I'm wondering about a lasting impact here that may or may not be resolved in the adult life.
I want to kind of segue, listening to the two fabulous panelists that you do have. I'm focusing on what feels like a very westernized problem around social media. And I'm not for a moment disputing that this is not hugely impacting and needs a huge amount of attention by all government departments across our country around the impact of social media, which is the leading cause of mental health disturbances in our youth. I'm going to segue into the trauma part that has been so beautifully described here of what's happening to our youth. And as you're hearing, the incidence of depression, anxiety, and obviously suicidality, substance use, disordered eating is a direct result of what's happening at home and in the context of what's going on with children. that if you grow up in an environment where there's such a lack of safety, and this is not a blaming of parents, where children develop what's called developmental trauma disorder because the trajectory of their development is going to be disrupted due to the violence they're witnessing or they're receiving, that sense of abandonment and neglect that they're experiencing. What happens to them is that their nervous systems become very disrupted. Their brains become what we call get on fire. And whether we're talking about violence at home or we're talking about social media, I am going to bring in the neuroscience of what happens to a young brain that has been so disturbed by situations. So for any young person's brain, the development only really becomes completed around age 25 years old. So the connections between their emotional brain, their limbic system, and the decision-making brain, which is their prefrontal cortex, is not really well developed yet. They're still developing the rational part of their brain. And those two parts, the limbic system and the prefrontal cortex, develop at different rates. So you have a child who has got a rational part of the brain which isn't fully developed. And that means that kids are going to be very reactive. They have impulsive thinking. They are focused in the moment. They want relief from the feelings of depression, anxiety, lack of security, abandonment, neglect, and sexual abuse as well. And what happens is that they will find things to distract themselves from feeling that way, which is where substance abuse, eating disorder, self-harm, and social media will come in as a wonderful distraction. But the problem is that social media is going to exacerbate that disrupted feeling, that lack of impulse control. And then you're going to end up with kids who are feeling much more lonely, much more depressed, much more anxious, and will turn to alcohol, substance abuse, eating disorders, suicidality as a way of managing what is called anxiety and depression. And so we end up in this incredibly difficult position where we have youth who are at terribly high risk.
Ms. Mkhize, let's come to you. This is a first research of its kind, conducting a study on adolescents. What did you do with that research? Who do you hand it to? And what are the outcomes that are hoped for?
Thank you, Polly, for that great question. So I think, as I mentioned earlier, this is this is just the first phase of the research. And the second phase of the research is that now that, we have identified that we have, these young adolescents who are experiencing depression and anxiety, it's our ethical obligation to provide them with mental health support. So what we've done is that we've collaborated with the World Health Organization, and we have been working to adapt and test a program called Early Adolescent Skills for Emotions, EASE for short, in the Western Cape province with adolescents who are 10 to 14 years who are experiencing symptoms of depression and anxiety and their caregivers. And just to add to what Ms. Nyoni spoke about is that what we want is that we want to provide evidence-based mental health interventions in our context that we know are not only age appropriate, but culturally appropriate, which is why we have co-adapted this intervention with adolescents and caregivers, because we want to make sure that the program really is appropriate and effective in reducing symptoms of depression and anxiety among these young adolescents. And this is also part of us disseminating our findings. But even more to that is that we need to make sure that there are comprehensive mental health support in our school systems, and that adolescents have exposure to such programs like the EASE program that are evidence-based, that we know work, and that focus on teaching them these social and emotional skills that will help reduce them developing mental health conditions later on in life. So these targeted interventions are very important, and that's what we've been working on, and we will be publishing those results very soon. And, we cannot work in isolation with the parents. Parents play a very crucial role in adolescent mental health. So we need to involve both the parents and caregivers of adolescents if we want to holistically make sure that we provide targeted and evidence-based intervention and support for these young adolescents. And I'll also add that we also need to have more mental health professionals in our school settings. This includes social workers, registered counselors, and psychologists to provide ongoing psychosocial support and counseling to these young adolescents. And this age group is very crucial, just to add to what Dr. E has mentioned, that this age group is very, very, very crucial. And research has shown that most mental health conditions develop before the age of 14. So what we want to promote, early intervention for mental health in our school settings for these young adolescents.
Ms. Nyoni, you probably are going to have the last word because of time. Your department has the power. It has the power to intervene and intervene decisively. So I want to use the example of a broken home where there's simply dysfunction. Mom and dad, they abuse alcohol or drugs. That child needs rescuing. What do you do as a department when you find children in homes such as that?
Okay, we department, we really discourage, removing children from their family environment and from the environment that is familiar to them. However, if the parents, are lacking, the care and protection that we expect them to provide to children, then we have alternative care that we provide to such children. But while we work with children, we're also not leaving the parents behind, because at the end of the day, we really need to see our reunification, rehabilitation, and reconstruction programs also thriving, because we work with what is not working, trying to fix it, and we really run away from, using the word broken home, because ultimately we need children to be in their homes at the end of the day. So as a department, we really, emphasize to say we need to capacitate parents to be able to care for their own children. However, if that is not sufficient, then we empower parents. We have programs like your parental skills program, family enrichment programs, while we also give alternative care to children and also work with other stakeholders, be it enriching their minds, but also capacitating them to be able to return back to their home when it's safe to do so. So I would also like to add to say that as we continue embarking on our awareness raising, education and information sessions in the different communities, we are now going to strengthen our services, 365-day services, and we'll be focusing in Northwest Province, where we have identified hotspot schools where children have attempted suicide. And we want to work with that community to strengthen their capacity, but also to educate both children and parents to be able to care for their children. And we'll be going there on the 17th of August, as well as the 24th of August, working with other stakeholders like your Department of Health, Films and Publications, as well as a Department of Education, and those who are able to provide psychosocial support for these children, which are your organizations that work with mental health. So we will continue for the 365 days in this financial year, raising awareness and highlighting issues of mental health as an important factor that, is supposed to be provided to children to safeguard them.
Cynthia Nyoni is with the Social Development Department. Thank you very much for your contribution to the discussion. We also had Mariam Mkhize, and she is a mental health researcher at UCT, and they are the ones that conducted the broad research around adolescence and the question of anxiety and depression. Dr. Eve, a family therapist, thank you very much for your contribution.